Okay, hi everyone. So in this video, I'll be teaching the last topic in psychology and health, which is the fifth topic, which is health promotion. Okay, now before I start talking about health promotion, let me tell you what um, health promotion is about. Now, health promotion aims to enhance good health and prevent illness. So this is an example of a poster promoting pooping. It's just a joke for you. Okay, how it's good. If you look around, even in schools, there are posters about let's say how smoking is bad for you. There are also posters about healthy eating. That's an example of health promotion. Okay, now these are some other examples. Okay, for example, a poster. Again, poster is just an example of health promotion. There are other methods on other methods to promote health. Okay, so from the impact of smoking, how it's good, sorry, it's not good, how it's bad. Okay, there are also promotion on mental health awareness, and this is the most famous one nowadays on coronavirus. So basically, what are the signs and symptoms and how you can protect yourself. So that is a brief introduction to health promotion. Now in this topic, we will look at three subtopics as usual. So the first subtopic, strategies for promoting health, which is what I'm doing today. Second subtopic is health promotion in schools, work sites and communities, and the third subtopic is individual factors in changing health belief. So under the first subtopic, we'll look at three things, which are the strategies for promoting health, which includes fear arousal. Okay, now basically, if you look at if you have ever seen a cigarette box where they come with pictures, and the pictures are usually gruesome, like lung cancer or premature birth or amputation. Okay, so that is one way for them to create fear in smokers so that they will change their behavior. Okay, we will also look at Yale model of communication, how we can communicate information effectively to promote health. We will also look at providing information how it's useful to effectively promote health. Now, so the first strategy is fear arousal. What is fear arousal? It involves a message being presented to a target audience. So let's say smoking, so the target audience is smokers, with the aim of scaring or creating fear in them in order to change their perceptions and motivate them to act. Okay, let's say for example, if you want to talk about healthy eating, so your target audience are people who are obese. So we want to change the perception about eating, and we want to motivate them to eat more healthy. Okay. Now the idea behind fear arousal is that if an appeal is very upsetting, it scares people into changing their behavior, so they can see the long-term effect, what might happen to them if they continue with their behavior, so we can actually scare them into changing their behavior. Now we are going to look at two studies on fear arousal. The first one is COPE on chip pen fires, and then Chanis and Feshbach on oral and dental hygiene. Okay, so what is chip pen fire? So basically when you are this is the according to your notes, during 1989, which is when COPE was doing this, chip fan fires were a major cause of domestic fires, so house fires were caused by chip pans. Okay, in 1981 there were 21 deaths and 1,000 plus injuries caused by 15,000 chip pan fires in the UK only. So it's pretty common where sometimes we forget that we're cooking, so the stove is open, the fires can go wild. Okay, so the house can catch fire because of this. Okay, so COPE wanted to promote health in such a way to promote self-safety in terms of chip pan fire. Okay, so the study aimed to test the effectiveness of an advertising campaign warning people about chip pan fires. So here the method that they use is advertising, so adverts that you see on the TV. Okay, so not just posters but advert. Okay, so they used quasi experiment, okay, which is a natural experiment. We do not manipulate the IV or TV. The procedure is basically the advertisement shown on TV in 10 UK regional television areas. Okay, so they showed the advert on TV. Okay, here's an example of what the advert might look like.
A chip pan more than half full of oil or fat will bubble over when you add the chips. this happens to you, first turn off the heat. Second, run a tea towel under a tap and wring it out till it's damp. Then place it over the flames. Finally, leave the pan alone until it's completely cooled down. Of course, if you don't overfill your chip pan, you won't have to do any of this. Fire. If you don't let it start, you won't have to stop it.
So this is an example of how they could have promoted promoted it on advertisement. Okay, so what was the result of the study? After the advert was going around in 10 regional TVs in UK, they showed a net decline in each area over a 12-month period from between 7% to 25%. So there was a decline in chip pan fires after, which means it worked. Okay, largest reduction was actually during the time that the campaign was running. So which means after the advertisement was no longer being shown on TV, the numbers started to increase again. Okay, so they did a questionnaire, okay, to see why was there a decrease in chip pan fire during that period. And it's because most of it revealed that there was a significant increase in awareness. So the public was saying that they are now more aware of what to do and what not to do to avoid chip pan fire. Okay, so what was the conclusion? So advertisement prove effectiveness in promoting health. So we can use advertisement to promote health, and in this case to promote about reduction in chip pan fires. Okay, now they did notice something. As time passes, so let's say this study was done in 1989. So as time passes, so around a year or 2 years later, the effectiveness of the campaign also declines. Okay, so it was only effective during the campaign. After the campaign, the numbers started to increase again. Okay, so and then they found that viewers are also less likely to be influenced by the campaign if overexposed. So if they keep playing it over and over again in the TV, it somehow shows that the viewers are less likely to be influenced. Okay, so that is the study by Cope. Now we're gonna look at Janice and Feshbach about dental hygiene. So Janice and Feshbach wanted to see fear arousal and what kind of fear we should use to promote health. So she compared three types of fear. Okay, high fear, medium fear, low fear, control. Okay, now let's say in the high fear, they would show pictures that can cause more fear. Okay, and then low fear is minimal fear in terms of dental hygiene. So in this case, there were 50 participants in high fear, medium fear, there were 50 participants, low fear, there were 50, control, there was 50. In the control, what happened? In the control condition, they receive a presentation on human eye function. Okay, so nothing to do with dental hygiene. Okay, so in this study, they wanted to test if level of fear would have a behavioral consequences in relation to the participants' brushing of teeth. So which of this level is most effective? Is it showing them high fear or showing them low fear? Which one is more effective in changing their behavior in terms of dental hygiene? So in terms of teeth brushing here. Okay. So what was the procedure? All the participants in this study, okay, they were they heard recorded talks about hygiene, and they were shown slides accordingly. So for example, in the high fear, they were shown graphic photographs of oral infections and decayed teeth. Participants in the low fear, they were shown diagrams of cavities and pictures of healthy teeth. Okay, so do you see the difference? So they want to see which type of fear arousal, which level of fear arousal is the most effective. Is it showing them high fear or low fear is more likely to change their behavior? Okay, now I was gonna show pictures of oral infection and decayed teeth, but it was too gruesome. I didn't want to show it. Okay, so immediate results. After they were shown the video, they were asked whether they were worried about tooth decay, and as you can see in the high fear group, they were more worried compared to low fear group. So there was higher fear in the high fear group. Okay, so they were more worried about tooth decay when we questioned them. Okay, so the greatest impact, immediate impact, was the high fear. So it worked with them. When you ask them, so are you gonna after watching the videos, after watching the slides, they were asked whether they are now worried about tooth decays, and most of them actually said yes. Okay, compared to low fear. So that's the immediate results. You can see the immediate worry in the high fear group. However, after a week, the participants were given questionnaires asking how toothbrushing behavior changed. You would have thought the high fear group would have changed more behavior, but no, it was actually the low fear. 50% of them changed their habits because they now want to avoid tooth decay. Okay, again, at first it was a high fear group who was worried, but then it turns out those in the low fear group were more worried in the long run. Okay, and they changed their habits. What is the explanation for this? Students in high fear group had a quick emotional reaction, so right after they were worried, but after a while they had less behavior change. Okay, studies in low fear group received specific practical instructions. Those instructions may have been lost in the high fear group after watching the fear arousing images. Okay, so they might have forgotten about this because they were too scared of watching the pictures. So there's a high chance they forgot about the specific practical instructions. Okay, so what is the conclusion? In terms of level of fear, it is best to use low fear, minimal fear. It was found more effective in this study than the other two messages, which is the medium fear and the strong fear, in encouraging students to adopt the recommended practices of oral hygiene. So strong fear was the least effective. Now this might explain why some smokers, they don't even bother watching the pictures shown on the cigarette box. Okay, because they use strong fear. There's a high chance they only reacted quickly. There was just a quick emotional reaction but less behavior change. So that might explain why it's not helping them change their behavior. Maybe they should have used minimal fear in terms of changing smoking behavior as well. Okay, now the second subtopic in this subtopic is Yale model of communication. So how can we communicate strategies to promote health effectively? Okay, so there are 5 steps. So the first one is the source. Is the presenter of the message credible and expert or trustworthy? So we have to think about those who are providing this message. Okay, if it's poster, if there is a Ministry of Health logo, then we know it's trustworthy, so people are more likely to believe it. Okay, so the source of the message. If it's an advert, we are more likely to listen if the presenter of the message is credible. If you have ever seen this ads on Astro about earthquake and how to do it, they use Manny Pacquiao as a model to present the message, and I would say he's trustworthy in terms of that. Okay, so the source of the message, the model that you're using, that you are using to relay the message, it has to be trustworthy. Okay, so that people can actually listen. Now the second was the message itself. Is it clear or direct? Is it one-sided or two-sided? Now we have to think about the message. It cannot be too long. If it's a poster, it cannot be too much words. Okay, we have to think about how we want to make it clear and we want to make it direct. Okay, now the medium. Is the message personal? Is it done via television, radio, or printed? Now, if you are to do it in Brunei, obviously television in terms of Brunei is not a famous way to do it, because not a lot of Bruneians watch RTB nowadays. Okay, maybe one medium would be social media. Okay, who's the target audience? Who is the target audience? School children, communities. Now, for example, if it's about smoking, should we do it to school children, primary school, or that's too early for them, so that they wouldn't actually care because they feel like it's not targeted to them because they are not in the right at the right age to smoke yet. Okay, so we have to think about the target audience. And then the situation, where will be the message be presented, in the home or medical surgery? Now, if you want to talk about dental hygiene and you paste it in a maternity ward where people give birth, that's not actually a good situation, because it's people are more worried about giving birth rather than the dental. Okay, so we have to think about that. So these are the 5 things that we have to think before we promote health: the source, the message itself, the medium, the target audience, and the situation. And that's Yale model of communication. Now we are gonna look at providing information, which is the third subtopic. So if people want to live healthier lives, they need to know what to do. They need to be provided with information. Posters placed in medical settings can be a major source of information. Better still is when a practitioner provides information to a patient, but studies have shown that patients do not remember most of what they're told. If you remember this in patient-practitioner relationship, written information is better. So for example, about washing hands, it's better if we provide information on top of the sink, the steps, okay, because not everyone is going to remember the steps, so it's better to provide information right there in front of them. Okay, so in this study, it's about people who had suffered a heart attack. Okay, so 176 patients, this is by Lewin et al., who had suffered a heart attack. So they were randomly allocated to either self-help rehabilitation program based on a heart manual, or a standard care plus a placebo package of information and informal counseling. So basically, excuse me, the 176 patients were divided into 2 groups. One where they do the rehab themselves, and they're just given a heart health manual to tell them what to do. Okay, so information is provided to them. Or they do a standard care where they usually go for appointments and things like that. Okay. When we compare between the 2 groups, when they were provided information on the normal standard care, psychological adjustment was better in the rehabilitation group at 1 year. After 1 year, this one found that to be more adjusted in terms psychologically. Okay, the group with the heart health manual with the information also had significantly less contact with their general practitioners during the following year, and significantly fewer were readmitted to hospital in the first 6 months. So which means this group that was provided a heart health manual, were provided information, did better in terms of being healthy. So in terms of promoting health, it is better to provide information. And that's it. Thank